open the meeting, officially start it, and then we'll hand it over to Paul for the fiscal part of the meeting. So I would like to call the joint meeting of the Fiscal Managers Subcommittee and the full Cumberland School Committee to order at 5:34 p.m. on March 30th, 2021. The Fiscal Management Subcommittee and the Cumberland School Committee will meet tonight in accordance with Governor McKee's Executive Order 21-21 dated March 3rd, 2021. The Cumberland School Committee intends to conduct this meeting remotely. The public can participate in this meeting remotely, but not in person, by calling 301-715-8592, webinar ID 916-8890-6445, or they can join via Zoom by going to the Cumberland Schools website, to the events calendar, and clicking on the Zoom link. So shall I hand it over to you right now, Mr. DeMonica, or do you want me to go get approval of the agenda?
Let's do the approval of the agenda, and then we'll move forward.
Okay, so the first item here is approval of the agenda. So I need a motion to approve the agenda.
Make that motion, Madam Chair.
Motion by Mr. DeMonica.
Second.
Second by Ms. Smith. All in favor?
Aye.
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 Opposed? The ayes have it 7-0.
Great.
And then I'll just finish this last one, Paul. So well, I didn't say this, but I'll just say, in compliance with Governor's Executive Order 21-21 dated March 3rd, 2021, discussion or vote on whether there is public access to the meeting through adequate alternative means. And Mr. Chandler, I see we have the public.
Yes.
Okay. All right. Perfect. All right. Over to you, Mr. DeMonica.
Thank you, Madam Chair. Okay, up is the proposed budget by the superintendent for the school year coming up, and I will turn this over to the superintendent, and then we'll get Mr. Prignano going. And after the presentation by the superintendent, we will have public comment for the public to make any comments that they would like about the proposed budget. I would ask that you please state your name and address for the record. And the school committee has a policy that the comments are no more than 3 minutes in length. And then we'll just keep on moving on and go through the public. And obviously the school committee members can ask the superintendent questions as he's given his presentation with the business manager. So Mr. Mitchell, we'll turn this over to you.
Thank you, Mr. Chairman. Good evening, members of the school committee. See Mr. Kinch is here. Central office personnel are in the meeting to answer any questions that we may have specific to their areas of expertise. And I see that we also have a number of our school administrators here as well. So what I thought I would do very quickly, Mr. Chairman, is just give a quick summary of where we are and just sort of review the transmittal letter. And then I would like to turn it over to Mr. Prignano, and he can walk us through the budget. And between Mr. Prignano, myself, and other members of our leadership team present this evening, hopefully we can answer any questions that you may have. And those that we can't, we'll make sure that we document the questions and get the information that you all need. As I stated in the transmittal letter, which I know all of the school committee members have seen, we're requesting $74,361,874 to continue the good work happening in Cumberland. And we know that year after year, there's a lot of work to be done to submit a balanced budget. And as I identified in my transmittal letter, we know that we had a budget shortfall of approximately $4.2 million. And there are a number of reasons for that. One is, when we talk about this all the time, the use of fund balance. When you use money in the bank to pay your bills, you have to put that money back. So we used $2.3 million in fund balance last year. We know with step increases, there's always going to be an added expense to the cost of paying certified staff members, specifically related to step increases, $440,000 just for that. Healthcare claims, we know that healthcare costs don't go down. They continuously go up. We're looking at $432,000 in additional healthcare claim costs. Transportation, another issue that we have spent a lot of time talking about, $546,000. And we have this RIDE mandated curriculum update that we are required to do by the Department of Ed. And we're looking at $300,000 this year, and it's going to cost us significantly more than that over the next couple of years. And as you all know, one of the things that we struggle with year after year is the charter school tuitions. And we're looking at a $175,000 increase in charter school tuition. So all of these things, as you can imagine, contribute to the shortfall that we need to focus our attention on. And, you know, as I stated, I mean, our most important goal is to continue to improve the performance of our students. And as I've said time after time, and any opportunity that I get to talk to all of you, in order for our students to get better, we know that the adults working with our students have to get better as well. So there needs to be a real focus on professional development related activities in the school department. And the single biggest fear, if I could speak for everyone, I don't think that there is a person here that would deny the concern that we would have for any lost positions. We've worked really hard to get where we are. We lost some positions last year, and our greatest fear is losing positions. The only positions that we have added to the budget before you are teacher aides that are needed for special education. And I've said this many times before, but I think it's really important for everyone to know that the money that we spend on special education, and we're not talking about a tremendous amount of money here, by the way, the money that we spend on special education allows us to continue to keep our students in district in the special programs that have been developed by Dr. Santa and other administrators and special educators. So Dr. Santa and her team are doing a great job of keeping students in district. And the reason I mention that is because if we don't keep them here, then we have to send them potentially to an out-of-district placement, which can be incredibly costly, as much as $100,000 for an individual student. Now, that's not an exaggeration. That is the truth. So we have, over the years, done a really good job of keeping our students in district where they should be, in the least restrictive environment. Kudos to special education. So the only additions staff-wise at this point is for special education teacher assistants. As we often do, in order for us to balance this budget, we're asking the town for $1,848,000 from the town, of 4% increase. And I can tell you, if we do not get that money, then there is a good possibility that we're going to be losing more positions. The money, we're as lean can be. We've had countless committees over the year audit our finances. And, you know, all of these committees are in agreement that we are spending our money wisely. If we don't get that money, our fear is that we will be losing really important and much needed positions. As everyone knows, there is ESSER 2 funds. In fact, I got an email this afternoon that I shared with the central office leadership, and I will share it with members of the school committee. Haven't even had a chance to really sink my teeth into it. I literally got it, like at 5 o'clock this afternoon. It provides some guidance as to how we can use the $2 million plus that we are getting from the federal government. And I can tell you there are lots of restrictions on how that money can be used. Our hope, and we can share with you at some point, our tentative plan on how we'd like to use that money. And of course, the focus of our attention is going to be on recovering learning loss as a result of the pandemic. And not only is the focus going to be on learning and learning recovery, I'm sure everyone understands the need to focus attention on mental health as well, because we know that this pandemic has really taken its toll on mental health, not only of students in all honesty, but lots of adults as well. So I just want to say one other really important thing before we start to get into the nitty-gritty, Mr. Chairman, and that is this. When we ask our administrators, all of them, central office and our building administrators, we ask them to, regardless of the challenges we face fiscally in Cumberland, and Cumberland's not the only town that has fiscal challenges, but we spend less per pupil than anybody else, which makes it more challenging. We ask our administrators to submit a budget requesting what they feel they need to move their schools forward. And I can tell you that I think one of the things that we have done exceptionally well in Cumberland, the Mr. Damana, his team, and all of the building leaders are masterful at making data-driven decisions. So I can tell you that all of the administrators have identified positions like interventionists and essentials positions that we know are necessary to move our students to proficiency or above. So, and I can tell you right now that we didn't add any of those positions. We're hoping that with the recovery money, we'll be able to add positions, but none of those positions are in this budget. And one of the other things that everyone requested, we lost some school counselors last year. As you all know, you heard a rather lengthy presentation by our school counselors and the work that they do. They all requested that those positions be put back as well. So I just wanted to, give you an introduction as to where we are, our thinking in developing a budget. And I think the most important thing that I would hope everyone understands as we start to talk about this is that any positions that we would like to add, they're data-driven positions that we feel we need to move this, continue to move this district forward. So with that, Mr. Chairman, members of the school committee, I'd like to turn it over now to Mr. Prignano, and we can start to walk through the budget and answer any questions that you may have.
Thank you, Mr. Mitchell. Just one item. If you could share that email with the members of the school committee when you get an opportunity to send it out. And on Thursday of this week, will you have recommendations for the school committee, how we can use that money when we have the vote?
I'm glad you asked that. We're prepared. We've had tentative conversations. I shouldn't say tentative. We've actually had some really in-depth conversations about how that money could be used. It doesn't have to be tonight, but certainly if you wanted to get a sense of our thinking and our vision this evening, we have a slide that we could share with you, or we could wait until Thursday to do that. So we do have that information for you if you'd like to see it tonight. If not, we'll see how things go time-wise. We'll have that we have it now, but we'll have it for you Wednesday if you want to wait till then. And I just want to remind everyone that, there may be some, minor changes to it, but we've spent a lot of time thinking about it as a central office leadership team. And I know that Tony and his team have really started to dig in to that as well. So long-winded response to your question, Mr. Chairman.
If we do have the time tonight, yeah, definitely just take a look at it, and we'll go from there on Thursday. I mean, with your proposed budget and whatever the school committee votes to send to the town tonight, not tonight, by the first Monday in April, we'll always end up coming back anyways in June or early July after the town council and the mayor's had an opportunity to approve the budget, so that we can reconcile what was appropriated to the school department and have a balanced budget. So this budget, still, even though we send it to the town, it still won't be, finalized until we know that exact number that the town council appropriates to the school department. So with that, Mr. Pignano, I think we're ready to go. Just want to pop out for 1 sec. Mr. Chandler, if you were able to get that budget up online for the public?
Yes, I'm just finishing it now. Just give me another minute and it will be done.
Sure,
And then
sure.
I'll share Alex's stuff while he's going through that now, but
Great.
that'll all be online.
So for the public that's here tonight, Mr. Chandler is getting that budget presentation up online tonight at the school department website, so that you can follow along with the budget. So go ahead, Mr. Pignano. Thank you.
Yeah, good evening, everyone. Last Thursday, I took us all through the budget, 45 pages, page by page, kind of pointing out some of the major items by department, by school, location, right through to the fringe benefits or whatever. I wasn't going to do that tonight. I don't know if, I was a little bit confused at the beginning of the meeting. I wasn't sure from the discussion about whether the budget was in the drive or not, whether people had that last week when I was walking through it to point out certain items. If the consensus is you want me to do something like that, again, I can. But what I was going to do tonight, since we kind of covered that, just so when you started looking at the budget yourself, you could have made some notes to say, oh, gee, I remember Alex saying this was this on page 12 or whatever. We're more or less going to take you through the significant budget changes that occurred. In Bob's letter transmittal, I know we show the gap that we faced, and he outlined it a lot verbally tonight, and you all have that. Where you see the 4.2 million. Hold on, I've got to do something here with George, apparently.
It's all right.
I'm hoping that Louis doesn't go cuckoo as well.
All right.
George apologizes. I have to. George! A fly goes by the house. He has a stroke. Anyhow, I was going to tonight take people through the budget, significant budget changes. Like I said, we've kind of identified the $4.2 million gap, and I took people through. It's kind of made you guys late for executive session last week. So unless people want me to do that again, I wouldn't do that. I would just answer questions if there were any. So, and then I think Tony wanted to give the committee to see some of the positions he's thinking of with the ESSA money. So I think we have a slide on that also. So let me start with the significant budget changes. And Mike, if you want to put that slide up, I'd appreciate it.
Okay.
There we go. Everyone see that?
Yeah.
Okay. Yeah, this is, if you look at the left-hand column there, FY21, that's the budget as it sits today, 74,548,000. And as Bob mentioned, the request this year, 74,361. So almost virtually the same budget within a couple $100,000. But there's a lot of swings in that budget that go both ways. So, for example, I'll take you through what I think are major items, significant changes, items that are $100,000 or so or more. For example, town appropriation, you see this year, we're scheduled to get 46,208,000. A request next year, 47,286, up $1,078,000. Now, I get that by taking a 4% ask of the town, which will generate, 1% generates about $700,000. So it takes that $2.8 million. And then because the town has this unsynchronized tax collections levy, 55% of that would come in next year's budget. So I take 55% of that 2,000,008, and then I don't make the assumption that the school department would get every penny of it. I've in discussions with the mayor, and he's made presentations to us. We know the town has also some needs. So that $1,078,000 represents 70% of what would be generated if the town would have raised its levy 4% next year. The 55% coming in next year, and us getting 70% of that 55%.
I
So that's a-
apologize if I could interrupt for one moment. I'm sorry.
It's all right. Go ahead, Mrs. Smith.
Yes, I do need the screen enlarged. I am definitely blind to see the numbers, and I'm trying to look at another screen, but I don't want to lose sight of where you are either. Thank you.
I missed that. Carrie, are you able to view this?
I could not see it large enough, Alex, but it's fine now.
Oh, and I also sent an email out too with it. So if
Right,
that
and I'm
helps.
looking at that on another screen, but I want to be able to follow this as well.
Okay, all right. Then other town, if you recall last year, we were going to get $400,000 from the town if we needed it to balance our budget to help with healthcare claims. Well, as of now, we're projecting a small surplus of a few $100,000. And I believe the mayor is actually going to go to the council with a recommendation that be an adjustment in his budget that he's going to the council with. And so hopefully we're not going to need it. I think if we need it, obviously I think the town will live by its word, but I think they're confident that we'll probably balance our budget. And so we probably won't get that this year. But I've replaced it with $770,000 in 22. And I get that, but in a couple of different ways. I'm hoping that that the mayor will program the healthcare money, and return that. We didn't take it this year. I hope he would return it to us for next year if we need it. And one of the things I was suggesting is maybe because the town is doing this net metering or whatever, that they would pick up all utility costs for buildings in the district. And then they would get all the savings from the net metering and the company they're working with. And that would allow us maybe to save $500,000 in our budget. I was going to request that there used to be a time when the town gave us $400,000 for building repairs. When the state ran into trouble years ago, when the cities and towns, Cumberland was cut state aid. There was even one year where they were allowed to reduce the maintenance of effort amount given to cities and towns. The state allowed municipalities to do that. The $400,000 that we used to get went out of the budget. It's never come back. So, to try to get some of that money back for building repairs, I put a number of $250,000 in discussions. And then the last piece of it that I come up with is for our playground repairs, which isn't a big amount of money, but the town could probably use impact fees that they collect for that type of work to get our playgrounds in condition they should be. If you recall last year, members at least, even some of the members that are new were attending meetings, and Mrs. Bernardo went out with Will and I, and we did a kind of an inventory of all the different playgrounds. We have a list of some things that we think need to be addressed. And so those impact fees would help with that. The next item we had last year, one of the ways we got to balance the budget was coming up with $1.8 million that we asked for last year. The town did an $832,000 lease. The large portion of that was for for the health and safety security project we got going on at the high school. Some $600,000, $638,000, I believe, was for that, and the balance of it was for Chromebooks. I'm requesting a lease of $518,000 this year, and that number was, when I get down a little bit later, when we got the budget back from the town last year, we added a $518,000 lease to balance our budget after all the job pools and everything else that happened. And I think we put back jobs that were originally the superintendent had recommended to be laid off. And when some of those things didn't happen, we had to move to, we were going to do our own lease for $518,000. And we haven't done that. And I think we can get by this year without doing it. I would hope that that 518 could be in next year's budget. State aid, that's the number off the RIDE website right now. It's they call it the governor's recommended amount. I really don't know how that's going to play out. We're down some 89 kids due to homeschooling, and we're down some 200 and something kids in free and reduced lunch. Is something that I think is happening statewide on that free and reduced lunch because of the federal government feeding all children this year. I think a lot of people didn't feel there was a need to fill out the paperwork and actually get identified as a free and reduced student. So there's talk that they may look at a 3-year average for that or whatever, but those numbers right there wouldn't include any of those reductions. So we'll have to see how that plays out. Fund balance undesignated, we had $575,000 on the budget last year. And next week, I hope to go over our audit. We're going to get audits out to everyone, and I'll walk through the audit. And when you see our fund balance, we had designated some money for use in 21, but we also designated an amount, $789,372 for FY22, and that's that amount. You'll see it actually in the audited statements. And so that's a small increase in the amount of fund balance we're using. The fund balance under that, the $1,765,000, most of that is all from the COVID savings that we had last year, almost $1 million in busing alone. We talked about savings in utilities and supplies and all the rest of it. Almost all of that is from COVID savings. We don't have that this year, but I'm recommending whatever surplus we run this year, I'm hoping at least $300,000 that we could use to put in our budget that would help offset the costs of the curriculum items we're going to have to purchase through that RIDE mandating curriculum changes. And you'll see that when we go down below, talk about on the appropriation side. The RX rebates, I'm a little concerned about this number. The mayor mentioned in a meeting the other day that he did not think we were going to be getting that. I had responded that the town healthcare consultant had told me we would, as the last time we had spoken. And so I've tried to firm that number up this week. I've got at least 3 calls and a couple of emails into the consultant with no response back. So I'm a little bit nervous why I'm not getting a response back. So that may or may be a number. I hope we'll definitely have an answer before we pass this budget out. But right now, this would represent what I was told the first year of belonging to WB, the RX rebates would be paid to us. And then in future years, they would be offset against the whatever savings that were in rebates would be offset against the rate. So this represents 3/4 of those savings that I would have allowed to that will actually come in 22, and a quarter of it was scheduled to come in 21, the last quarter of this fiscal year. And then 3/4 come starting in next July. That would be something we would have to adjust if that's not going to be the case. The tech lease, this is the lease that we put in our budget last year that we didn't do. I've requested it up above against the town lease, that the 832, that they would do 518, so I've zeroed that out on our side. Building rentals in the preschool, we only budgeted 175 last year, not knowing how the pandemic would affect us. Not too bad in the preschool, but we haven't been able to rent our buildings out. And Alphabet, as you know, we made a 1-year agreement with them not to make them make a minimum payment because they didn't know if they'd even be able to open. And so we're gonna collect about $100,000 less than we have in the past. And but for next year, I've restored those building rentals in preschools to FY20 levels. There should be no reason why we don't go back to those rates if schools are open, and which, you know, everything's pointing to that. And then the last item is just a change. Everything else that's on the revenue side. This is basically the co-shares that people pay, the retirees pay for dental coverage and life insurance coverage, Medicaid revenues, all the other things. And you look at that revenue page that aren't really state aid or fund balance or town appropriation. And there's just a small change in there of about $19,000. That basically we budgeted $600,000 last year for CTEs. We weren't going to collect the full 6 this year. I brought it down to 5. That's, you know, that's the major piece of that. So that gets you to the same. That gets you to the 74,361 or $186,000 less than last year's budget. Any questions on the revenues before I go down below to the appropriations? Okay. On the appropriation side, all salaries in the budget are going to change from $40,059,000 to $40,499,000. I list CTA steps. It's not just CTA steps. It's some of the TAs and stuff, but the lion's share of that, more than the difference of 440, is in step increases with you know, that teachers have built into not only their contract but state law. Like Bob has mentioned, I think several times, there are no raises in there for anyone other than something like step increases. Building subs this year, as you recall, we hired building subs because we wanted building subs to not be traveling around the district because of COVID. We didn't want someone bringing COVID, you know, to 3 schools because they were subbing in 3 different locations. We had $270 in the budget last year. We don't have anything in this year's budget for that. We do have regular substitute lines that we've had in the past for regular professional development and just normal illness, you know, that occurs during the course of the year. Those numbers, if you look at any of the schools, you'll see them in the salary accounts. Very similar to the numbers we've had in the past, but this added benefit of having a you know, identified building sub for a location is not in the budget at this point. Salary breakage was $269 last year, and I think people know what that is. We budget, you know, everyone to get paid for 52 weeks. Well, that doesn't happen. People retire, people leave, jobs become vacant at certain points of the year. So we don't know who that's going to be, but we build in a little bit of money here that figuring not everyone's going to get paid all 52 weeks. There'll be some people that will run out of sick time or retire or whatever. And so we've increased that to 421 next year. And in that, I have 3 not yet identified retirements. I don't know if we'll see those. That may be something we have to adjust the budget to when we get it back from the town, if those don't materialize. Katie, what do we have? 4 CTA retirements now, I think?
I think that was the last number, yeah.
Yeah, I think it's 4. So this would be hoping to get to 7. Healthcare claims, the town consultant has told me a 5% increase, 4.8 actually is the number he was using. I've used 5% right now in the budget. We'll actually see, you know, by September, by June, July, when we come back and pass the budget before school opens, we'll have, you know, a full year data with WB, and we'll get a harder number. Maybe that number can be a little bit less than 5%. With the last few months, we have been trending positively, so I'm hoping there may be some room there. Certified pension with the state, it's going from 17.5% to 17.78. Just that small 2.28% increase, as well as the increase in salaries for people who, the extra $500,000 or so for steps, that generates an additional $432,000, an additional $152,000 in an extra $243,000 extra in pension payments. The unemployment, this is an area that we took down, as you recall, last year. The original budget called for some layoffs that we didn't go through on, and so there's a surplus in that account this year. I'm bringing it back to the 125,000 that we usually have in the budget under a normal year, where we wouldn't be, having potentially significant layoffs. So that's a savings of 275 in the budget for us. The charter schools, no increase in the number of students, but there will be an increase in the rate. It always goes up. I've increased the rate by a couple $100 a student. And until we get the hard number from RIDE, it's always in that area between $200 and $250 or so. And that would generate the $174,000. Transportation, up $546,000. That's in a couple of areas we talked about the other night. It's in the 2.5% rate increase that Durham has in its contract. It's $174,000 of starting to repay the money that they've deferred in the past. And then there's a couple $100,000 on the state contract. We had budgeted $670 this year. They came back in the middle of the year. People will recall, they said we were going to spend $1,030,000, like overspend it by like $400-something thousand. And then they came back later saying that they couldn't fill all those runs, that between distance learning, they didn't need all those runs. And they told us we'd be about 770, 780. That's what we're projecting. And then there's always an increase in that contract each year. I've got that number in at 870 right now. So a $200,000 increase in there, a couple $100,000 for the increase itself of 2.5%. And then the 174 to start repaying Durham gives you the 546. Technology, we budgeted $915,000 last year. We bought somewhere close to 2,000 Chromebooks, not knowing what we were going to face with the pandemic. We had, if people recall, in March, April, May of last year, we had families sharing Chromebooks where you might have 2 or 3 students in a household using one Chromebook, which just wasn't practical. And so we made a large investments in Chromebooks that we won't have to make again this year. That $448,000 is for 10th grade, 1 grade at the elementary schools. And then most of that other stuff is some of the things we haven't done as far as servers and computer labs, et cetera, but a significant reduction there. The RIDE required curriculum that I talked about, that 300,000 up above fund balance other, is targeted to offset this RIDE curriculum increase that we're going to face over 3 years of somewhere around $1 million. So we put 300,000, that's in Tony's budget. Distance learning last year, we spent $138,000 on the software, IXL and Ingenuity and whatever, those some of the 3-year contracts in that. We shouldn't have to buy any distance learning software next year. So that came out of the budget. Special education, the budget's up about 152,000, most of it in OT and in nursing. And I think there's a student that will be in that has a 1-to-1 nurse that will be in school for longer time periods next year. And so there's an increase in the nursing line item as well as OT. Those are the major increases there. Facilities, a reduction of 273, and basically that is that's in a lot of the COVID supplies and repairs and stuff. We put a lot of money in the budget last year for that type of stuff, spent some of it. And then the state, after our budget was passed, and I don't think Will's on the call, but I mean, we constantly were getting sanitizer and, the purifiers were a thing that came in afterwards that we didn't know about. After we ended up going out and buying 50 more, they showed up with 300 purifiers. So we've made some reductions in those line items. The high school security project that we had budgeted is 658. Well, that's project's going to be complete, so it's out of the budget. And then everything else in the budget, all the other line items, a change of about $243,000, and you get the same 186,545 that you see above in changes on the revenue side. So I don't know if any questions on any of these, I'll try to answer for you.
Any members of the school committee? I can't see you all because of the
Mr.
screen,
Chair?
so just speak up.
I have a question.
Go ahead,
Yeah.
Mr. Shriven.
Alex, back to the revenue side on the town appropriation. So does this represent about a 98, a 0.98% increase?
No, what it is if the town were to give us 4%, that would come to about $1,848,000. And so you can't get to $1,848,000 by an increase in the levy alone, because of the way it's synchronized. Only 55% of that, if there would be a 4% increase, would be available in next year's budget, as 40-something% of it comes in this May and June, that first quarter. So that $1,078,000 represents 55% of a 4% increase at 70%. I figure we're 70% of the budget. So if they raised that and they gave us our share of the budget and kept 30% for themselves for items the town needs, it would give us $1,078,000. Then I get to the rest of the money by asking them to pick up other costs for us, whether it be building repairs, electricity, playground.
Okay, so I guess the question that I have, in our budget workshop, you had given us a sheet that shows since 2008, the town appropriation every year, and the percent increase each year. So what the total was, what the amount of the increase was, and what the percentage, what that equaled as the percentage. So, so last year, it was what's listed here is a 1.39% increase.
Right.
From the town.
Right, and that kind of makes the point. I believe the town increased its levy last year by 2%. So even though they increased it by 2%, because of the way the unsynchronization falls, it only generated 1.3% for us, because that money comes in over 2 fiscal years. So you're right, that 1.39% was the net increase. That's what $658,000 against the amount that they pay us represents.
And what would be the percent increase as you have it laid out here?
Well, if the 1,078,000 was maintenance of effort money, you would take that over the 46,208 and see what it represents for a percentage.
Yeah, I think it's 0.98, but
it won't be 4% because
no,
they're only giving us 55% of it, and then I'm only assuming 70%. Now the town could say, you know what, we're going to give you 82% of it, or 80% of it, or we're not increasing taxes at all.
Right. I guess, well, Alex, what I'm just trying to see is the trend here, and in understanding. So last year it was a 1.39% increase. The year before it was a 1.03 increase. The year before that it was 3.51%. The year before that it was 4%.
Right.
The year before that it was 2.5%.
I'll add on to that schedule if we were to get this 1,078. I'll let you know. I'll give you that for Thursday night.
Okay.
One other thing while we're mentioning this, the town, and I think the council, I think someone mentioned the town council president's on, so it's good that he would at least hear this. If they're going to do anything close to giving us, an increase in that levy, they will be acting on that levy at the end of this month. And so if they don't act on it now, it's like in July, it's too late. The levy's gone, it's passed. So that has to happen now. So we'll know we'll know what the town does, by the time we go down for budget hearings with the town council, we'll know if there's going to be an increase in the levy that would generate anything like this.
Mrs. Smith, you have a question?
Yes, thank you, Mr. Chair. Alex, in last evening, the mayor did do a presentation concerning how he's getting the levy, the tax levy. And based upon everything that he had presented, he was looking at the funding rate at 48.62%, I want to say. And then he was also looking, I believe, at the tax levy being 2.44% total. And I'm sure that President Kinch could re-clarify that for us. But with that in mind, should we be recalculating if this is a number that we know is already being presented to town council?
Well, it's up to the school committee whether they want to go to hearings and, when the levy's being set, and make their case that it needs to be higher for the schools. If it's 2.44 town-wide, that will generate under 1%, under 2% again for the school department. It'd be very difficult 3 years in a row to go under 1% now, unless, there's going to be federal dollars that can be plugged into this thing, which will just create, holes in future budgets. And I'm not sure the federal dollars at this point can be used to replace anything that's currently in the budget. I think it's more for new type of initiatives, whether it be in some areas capital or in new positions. So 2.44% would require significant changes here.
Right, and I do believe that was what was presented last evening. And I don't know, certainly we don't know what is going to be finally approved, but just something to keep in mind. And the other question I had for the RX rebate, can we try to follow up and see what we can get on that? Because
yeah, I talked with, I didn't talk with, I got an email from their, from the woman who is the head of that now. I know her she was a former business manager, very bright lady. And she sent me a worksheet. She told me she'd get on a Zoom call with me to go through it. I don't even want, the worksheet she sent me, the way I read it, would be that nowhere close to $282,000 would be available to us. So I will have an answer before Thursday. If I have an answer tomorrow, I'll email it out so people can start thinking about how we address this.
Great, thank you. And I will wait to ask my other questions, Mr. Chair, because they are related more so to the linking of the federal funds that we may receive and counselors and
Yep.
other TAs that are needed to increase that learning that's been lost.
Right. Mr. Collins?
I just want to add, I actually just went back my notes. I also, to Mrs. Smith's point, I also recognized the 2.44% levy that the mayor had on his sheet, but he did also emphasize that it's kind of a working document. And it was so I wrote it down. So I was I'm still going to withhold, judgment until we see the final numbers, because it was my understanding, just kind of working through the process, how he works the numbers backwards. And it made sense. And obviously, to get to the point where Alex is or the mayor is with the numbers, it does take time. But when he was working through the numbers, it made sense. But he did emphasize that is, not a final number, and it was just more of an exercise. So 2.44 was kind of like, oh,
I understand.
Yeah.
The last couple of years, the first year the mayor was in office, he discovered a lot of items that he felt he had to address that had been, I think, kind of the expression where they kind of like rob Peter to pay Paul in order to keep tax rates low or whatever. And I think he felt he had to address that they had used so much of one-time revenues, right? That
Yeah.
He wanted to replace his fund balance, that especially he's going out in the bond market for our $79 million bond and stuff. It's important to show, strengthen your financials and whatever. And then last year, there was a pandemic, there was unemployment, there was, no one really knew what was going to happen with that pandemic, whether how high unemployment might go, how the town might be affected. Turns out it wasn't really affected negatively at all. I think they've had a higher collection rate than ever before. But those amount of those increases haven't covered our step increases in those 2 years. So there was 1 year was 450, and 1 year 632. That $1,087,000, if you want to figure step increases of 550,000 a year, that's all that covered. So to see another 1-point-something% increase would, unless there's, the plan is to be able to use federal dollars to offset this. That's yet to materialize as far as I know. So that would be tough for the district.
Right. That levy sheet that the mayor showed the other night, for those that weren't in attendance, I know the mayor developed that sheet, and it's helped the town council as well when they see it, because they get a better understanding of how the levy is set, and if you change it by a percentage, what it generates for new taxes or whatever it may be. And so I think everyone that saw it the other night said, whoa, wait a minute here, we need to get up to the 4%. And Mr. Pignano's been very adamant with me as well in the chair that we make sure the mayor and the town council understands that we're looking for the full 4% increase that we can ask. They can always give us more. I think I saw an email today from one of the school committee members. They can always give us more, but state law, it was discovered about 4 years ago that you can only ask for 4% in any given year by a school department. They can always, appropriate more, but we can't ask more than the 4%. So
now you could get roughly to the same dollar amount, that the $1,078,000, at a 3% increase in the levy instead of 2.44. But it would require them to give us 90% of the money generated.
right,
So that, they would take 10% for, I don't know if they have an increase in their garbage contracts or whatever things fall on the town side. And at 90%, we could generate $1,040,000 at 3%. And that's basically the council has to kind of take a vote to override their own ordinance, because they have an ordinance that only allows them to raise the levy 3%,
right,
even though state law is 4%. So they can do it, but they would have to take a vote to do it. But
right.
they could get there at at 3%. There's ways to get there, but the lower that levy, the more of it we would need to generate any significant dollars to help offset the costs and the.
Right, just like when we did the joint town council meeting, and the mayor was in on that call, and he showed a sheet to us that showed their increases in healthcare, pension, and things like that. Either the levy that they can set to cover those costs, really the school department's step pay raises in healthcare and so forth should be on the mayor's list as well, so that everyone recognizes that these are increases that the town and the school department cannot overlook, because they're mandated by state law. And, I wish our numbers were included with the mayor's number to give the town council a better idea on one sheet of paper what we have to do. We can't get rid of step pay raises. There's no way around it. Originally we were told 5% on healthcare increase, and the mayor got an answer that it could be 3%. So things need to balance out here with that healthcare claim, and the rebate from prescription drug. That was a big thing, that we would get it. That the savings that the company that's managing our healthcare would be given back to us instead of like Blue Cross keeping it. So these are real things that we need to balance our budget. And there are other ways for the town to help us get to that number by changing the the leases or paying for the electric or whatever it may be, the utilities. So there are a bunch of ways to do it. I see Mrs. Rogalski has her hand up. Go ahead.
Thank you, Mr. Chair. First, Alex, thank you for all your hard work. I don't envy you. So looking at the revenues and the number, I'm remembering when we were discussing before the reduction in students and thus likely a reduction in federal aid based on the number of students who went elsewhere, the free and reduced lunches, the RX rebates. I mean, you could be potentially talking about $1 million loss in revenue between those three. Worst case scenario, you think?
The free and reduced amount, we get an extra $4,124 per student. So if down, I think it's 229, it's 200 something students, that alone could be, do the math there alone. And then you got 89 kids, we're down 89 kids in total because I think a number of children at the beginning of the year when we weren't sure what we were gonna be distance learning or not. I think a number of people opted to homeschool because they didn't want to send children to school. And so that's resulted in some type of a reduction also. So, yeah.
So there could be even more. I mean,
There could be, but I think there may be some effort to going on to kind of hold districts kind of harmless on some of this stuff, but that will all play out at the legislature and stuff like that.
Okay.
Maybe Governor McKee will have an answer there.
All right. Thanks.
Anyone else from the school committee here? Go ahead, Mrs. Smith.
Thank you. Just one question for now. The charter schools, what was the number? Do we know what the number was of parents who took the children and put them into private or charter schools because of the uncertainties that were happening at the beginning of the school year? Because I would expect that those tuitions should probably go down and that some of them will be coming back.
Yeah, I don't know. Is your question how many students went to charter school
Or
this year?
private school, right? How many stepped away from our public system because of the delays from the state at the beginning, so that we have some kind of estimation of maybe perhaps students that may come back in.
Yeah, I could tell you that. I don't have the exact numbers. I could tell you in 18, we budgeted for 497 students, 19,504. Both those years we ran good surpluses because the state was wrong in their estimates. I brought it down last year to 477. I ignored fool me once, shame on me, right? You know how the saying goes. I ignored them last year and I budgeted just 477, which we were actually had. In the 21 budget, we have 480 budgeted, and I'm carrying that same number forward in 22. No increase in students, just increase in the rate. The rate in 21 is 8,146. Excuse me, 8,146. We pay for every student that goes to charter school, and I'm using an estimated number of 8,347. So yeah, $201 more. And you can say, like in 20, it was 7,952, and the year
Right.
before 7780, 76. You can see if you look on page 44 in your budget, other tuitions, that's the charter schools, you'll see what the payments have been on the left-hand side. Back in FY12, they were 5689, and I have the payments, the actual payments and number of kids for those schools all broken out for you. So you can see the trend.
Right, and I guess that's what I was trying to do, is determine
Yep.
how many students, because if we had been over budgeting and then you did reduce it, and certainly
We have reduced it back from,
Right.
a high of 504 and 19 because it didn't get to that. And I think as Cumberland was doing,
yeah,
outperforming them in every category except one, I believe. I think, parents saw Cumberland as a place they wanted to send their kids. And I think we've had a lot of the superintendent talks about this a lot. We've had a number of kids return. And we haven't seen kids pouring out. Now, last year, some kids left because they were saying they were going to be open, and people who wanted to make sure their kids went to school because of work or whatever. And it turned out they had all sorts of COVID issues beginning of the year, and they were distance learning. I think they were distance learning almost the entire school at the beginning of the year when they opened. And so people signed up for something they didn't get. But I've got it at the same 480 kids.
Okay, and that's what I wanted to know is.
And that's all charter schools. That's not just
Right.
BVP.
Right, exactly what I was looking at. And I want to make sure that we're not over projecting the number
Yeah.
again, because certainly if we had over projected it for 2 years, then our number should be much closer to then what we had seen in that trend, whether it be 5 additional students or now leveling off because of all the schools now being open and completed. So I just want to make sure that we're not over budgeting
Yeah.
on that. Thank you.
Mr. Collins and then the superintendent. Go ahead, Mr. Collins.
I want to piggyback back off of what Ms. Smith just said. We saw a significant increase in homeschooling requests last fall and into the winter. Will that impact our financials at all? Assuming that they're with the vaccine, I don't want to say mitigated, but as things slowly crawl back to normal, would the return of homeschooled students back into the classroom, would that affect our financials at all?
If kids come back, it will. The latest numbers we have in the March data that I believe the IT department transmitted to RIDE, I think it had a reduction of 89 kids. So that's the latest information. Now, as kids come back, that'll help next year's state aid or whatever. If kids return back to Cumberland next year, that will help next year's number.
I mean, I think the legislature, we're hoping with the legislature that because of the anomaly here throughout the state of kids being homeschooled, that they don't take those numbers into consideration, or as Mr. Pignano said, and average it out, because every school district in the state's going to get hurt if they use that number. And Mr. Mitchell, you had a question?
Yes, thank you, Mr. Chairman. Coincidentally, regarding the homeschooling question and the private school question, as everyone knows, we know that we had an increase in the number of families who chose to homeschool this year. Letters went out today with a self-addressed stamped envelopes asking them to let us know if they were going to be having their children return to school in the fall. So those, so we'll be able to get some sense as to the number of students who will be returning. And I think we should be able to get a feel also for the number of students that families decided to put into private school for the reasons that, have been mentioned, are starting off in a hybrid model and the need for, families for whatever reason to have their children go to school every day. So, we'll get some sense when families respond to the letter that we sent home. We'll share that as soon as we get some sense as to the numbers.
Okay.
Thank you, Mr. Chairman.
Mrs. Smith, go ahead.
I'm sorry.
Don't be
Just
sorry.
another note to that as well is that it's important to note that there is a bill, and I believe it's one with the House and with the Senate, that is being reviewed again this week, that is requesting if a student leaves one of those charter schools and comes back into the town, that the funding comes with them immediately. And I know that that could help because in the past, as those students have come in, we've had to absorb them, but the funds had stayed with the charter school. So just something that I think could help us going forward, and we may see some adjustments with that. Oh, and then the second thing is, when do we know about the students that are coming to us from other districts. Is that also something that we're looking at, or
Yeah,
that has to be applied at a certain time that they have to apply to get into our programs?
I've had a talk with Heather and Adolfo, and there are additional students looking to attend this year. I don't think anything is yet firmed up. If you look at the revenue there, we budgeted 600,000 last year, but if you recall, I believe we're only going to collect about 450. I've been showing on my regular budget report about $150,000 shortfall. I've estimated 500,000 for 22 with the expectation that we will pick up some kids. So it could be a little bit more. Hopefully it'll be a little bit more, and it can cut into that rebate issue if we have an issue with that rebates. I don't think it'll be 282,000 more, but if we could pick up a few bucks there, and that's what I have to focus on before Thursday. I have to find out about that 282.
All right, you want to go on, Mr. Pignano, or are you done with your presentation?
No, I just wanted to, like I said, Mr. Mitchell the other night in his letter transmittal that he sent to you, we pointed out what the gap was, so you people on the committee could see exactly how we were facing a little over $4 million problem and what made it up. And like I wanted to walk you through the budget the other night so you could get a feel for some of where the money's spent, especially new members on the committee, where our dollars go, some of the bigger line items that they might want to ask questions on if my explanation wasn't clear enough. And then tonight I wanted to go through the significant budget changes. So you can, this is right here. This is the budget. What the budget's going 74,548 to 74,361 with about a dozen line items on each side of the budget getting you where you are.
Okay. Thank you, Mr. Pignano.
You're welcome.
Mrs. Friedman?
And maybe we can discuss this on Thursday, but I think Ms. Smith might have suggested this, that if there is a real possibility of what the levy will be set at and the impact that it will have, and we know, potentially going into this, that what we're asking for may not be what we get. Can we start considering what kind of cuts we would have to make? I mean, right now, this budget with the full 4% has no salary increases for teachers or administrators or anybody.
No, only,
and after, certainly the year that we've had, that is a hard enough pill to swallow, I think, but that's with the full amount, the full appropriation. So now if there's a possibility, and it sounds like, there's always a possibility, right, that the amount will be less, then where do those cuts start coming from? And I know we usually don't start talking about that until we get like all the way through and we get, several weeks into this with it going to the town council and everything. But I think we really need to be maybe a little more proactive and I don't know, start giving people an idea of what this really means. But
Mrs. Friedman, I agree with you 100% there. We need to be proactive with the mayor and the town council to show what we're doing. But, positions that we aren't adding in doesn't help the children, because since March of last year, it's been, kids are at home and we need to bring those services that we had cut back into the budget somehow and keep them there. Not just get a 1 year, shot in the budget and we get these staff and, and we help the children, but there's a lot of learning loss right now that we need to work to help the children going forward. So we have to be proactive with every member of the town council and the mayor and hope that they appropriate what we feel we need in order to run the school district. and we'll keep on moving forward. I see Mr. Collins has his hand up.
Thank you. A year ago when we were looking at the potential cuts, I remember I made a comment about COVID and we didn't understand the rippling effects COVID would have. And here we are a year later, and we're still in the throes of it, and we're finally getting kids back to school full time. But I think we're a whiles away from understanding the full impact that this is going to have, first of all, on learning loss, and then second on mental health, which the superintendent has addressed both. But I just can't envision us going into the fall having to take on these new challenges that come as a result of a pandemic, which we had no control over, with a limited budget, a skeleton crew to address it. We need these services in place. It's not, I think I don't want to say it's a non-starter, but we need to be putting things in place. And I'm not saying we shouldn't have a contingency plan, but I just can't imagine that anybody on the town side, the school side, anybody will look at the entire landscape and go, you know what? Now's the time to cut things. No, now's the time to stave off any sort of loss, not just academic loss, but I mean, we're seeing it anecdotally in the classroom right now. Kids who are in person. And I think we're looking at a serious mental health crisis, not just with students, but with adults as well, because it's going to be a bumpy transition back to normal. So I've said enough. I think most people agree with me, but we'll see.
I agree. April 16th, I guess all the children come back 5 days a week. But again, with RICAS testing being thrown into the mix there, it doesn't help, getting those kids, acclimated again and trying to catch up and, to speed in regards to it. So it's going to be tough. It's going to be a tough battle. And, we have to deal with the academic loss, both, in the classroom and mentally as well, if there's, go ahead,
And
Mr.
still that bringing students back 5 days a week, obviously should be the goal of the district, right? And that's what the district does. It teaches students, but that will affect the potential of a surplus of next year, being able to move $300,000 forward and those sort of things, because that additional 1 day of busing is expensive.
Right.
It's $12,000 a day. So how many additional days is that going to be? 10, 12, 15 days,
Right.
from April to the end of the year? How many
I saw-
Mondays are there,
Mr.
I saw
Chairman,
the
if I may.
superintendent and then Mrs. Feather and Mrs.
Okay,
Smith.
so just a couple of things related to what we're talking about right now. Who would argue that we don't have a responsibility to bring students back 5 days a week? I understand, the money, fiscal
think anyone.
impact. Okay, so we have a responsibility to get students back 5 days a week. That being said, and I've said this many times, I need to state publicly once again, we want kids back. However, we unfortunately, I don't know if that's a fair word to use under the circumstances, we have to assess distance learners. So distance learners have to take the RICAS. So we got to get them in to take the assessment. And the plan right now, and we can get into more detail if need be as time goes on, administrators have been working really hard on this. We're going to need to use some Mondays to get that done. So that's issue one. I know I'm preaching to the choir with the next thing I'm going to say, because we have this conversation every single year. And I mentioned it in my opening remarks. We have had a number of fiscal subcommittees, experts, if you will, do an audit of school expenditures. And by all accounts, we're as lean can be. We're frugal spenders, and we use our money wisely. So the reason I mention that is because if we don't get the money from the town that we're asking, the only place where that money is going to come from is in positions. The money is in positions. So the thing that I fear is that we're going to end up, that that we may lose more people. We've already lost people. Nobody wants to lose people. In fact, people bust my chops because I say we need to add people. And as Mr. Collins said, and as Mrs. Friedman said, and as Mr. DeMonica said, and I know every school committee member will say, we actually need more support. Mental health is a great example. People to address learning loss, another great example. But here's another thing that we are pretty sure is going to be one of the guiding factors in how we use the recovery money. We're not going to be able to supplant existing positions, or we're not going to be able to use recovery money, ESSER 2 money, to pay for things that have historically been a part of the budget. It's got to be new things focused on learning loss and mental health. So whatever we don't get from the town is with, in all probability, going to result in the loss of positions, which, is the, not to be overly dramatic, but the most heartbreaking thing of all, because we've worked hard to get to this point and we've needed every single person to contribute. I fear that losing, key individuals is going to significantly impact the performance of our students. So I just needed to state that publicly. Thank you for listening, Mr. Chairman and members of the school committee.
Mrs. Feather, did you have a question?
I did. Well, I just wanted to say as well, something about the distance learners and getting them in for RICAS, because I know as my family, they're distance learning students. And so we're working with the principals right now on figuring out how to get them safely in there as well. Given that they're, a lot of distance learners haven't been around people in a while. So that's definitely something that has to be measured along, along with the 5 days a week piece. And I wanted to also say that I agree. Mental health, I think, is the number one thing for me. I mean, we've all seen those quotes around students about how, we're falling behind. Yes, we know we're falling behind, but they're surviving a pandemic. It sounds cliche, it sounds corny, but at the end of the day, that's what I'm basing it on with my children. They're surviving a pandemic, and if their mental health is in good shape, then I'm doing something right. And I feel like we definitely need to address that in the schools, because when kids do come back, distance learners and the learners that have been in there throughout, I think that there's going to be just an incredible need for mental health services. So that's the piece that I'm concerned about financially as well. And then there was one other thing. Oh yeah, I was just going to mention how, we stack up on our per pupil spending. We are, Bob said it, we are frugal. We're very frugal. We have to be because a lot of our funding goes to the charter schools. So I really do hope that we are able to get what we've determined we need. Thank you.
Right. Mrs. Rogalski.
Thank you. Yeah, I just to echo what Mr. Mitchell and and pretty much what everyone's saying, I think what Mr. Mitchell was saying is what Ms. Friedman means. We have to put it out there that this is what we are facing. Town council, mayor, residents of the town, this is what's happening. I think the problem almost becomes that we've done so much with so little for so long. Everyone thinks, hey, you guys are fine, keep it up. This is not the year to do that, because we do need those resources. We will need those guidance counselors. I heard from a school nurse today saying that what they are seeing at the elementary level is disturbing in terms of social and emotional issues, and that the one guidance counselor can't handle it because she's split between two schools. So we know that need exists, and cutting those positions, it's just, I think Mr. Collins said too, you've got a looming mental health crisis. There are so many things that this is the year where I think we can least afford. And as I think it was Ms. Friedman was mentioning, this is, with what we're figuring, this is with hoping to get the max amount that we're asking for. And I don't know how often that happens, but I'm not thinking it happens very often. But there's just, mental health, special education. There are so many areas that are going to be affected by this, and those ripples that Mr. Collins talked about. This is the year where we desperately need that money more than anything. So I think it's good to be proactive and to tell everyone, listen, ABC has happened already. This is what's going to happen if we continue along these lines. If we don't get the funding, this is the potential. Have Dr. Santa Mr. Mitchell speak, just have them out there saying, this is what we're facing. I don't know that it will get through, but, to just have some blunt honesty might be good, because otherwise, like Karen said, I think we do have to start thinking about what is going to be cut, because if this is what it's going to stay, that's frankly scary to think what could happen.
Right. Anyone else? Mrs. Smith?
Yes, Superintendent Mitchell, is the addition of those guidance counselors in this new proposal? I know that this was last year, and there was now we're seeing the impact of it, and I'm just wondering if they've already been added back in by each schools.
Well, the building administrators requested them, but they're not in the budget. We've not added any positions, certified staff positions, that were taken out of the budget last year. So they're not in. And so everybody knows, when we look at our plan at this point for using the ESSER 2 money, you will see how we plan to use those funds, or some of the funds, for mental health. And Dr. Santa, Mr. Damana have spent a lot of time. I know that Mr. Prignano have focused a lot of time on how best to use that ESSER money to meet the mental health needs of our students. So rather than school counselors, I'm not suggesting for a moment that school counselors aren't important. I led that charge a couple of years ago to get one in every school, but we feel that we'll get a bigger bang for our fiscal dollar with social workers and psychologists to address the mental health needs. And remember, we wouldn't be able to use, at least as I understand it right now, we would not be able to use ESSER 2 funds to put school counselors back into the budget, because that would be supplanting what came out in the past. So, and I'm not 100% sure about that, but I'm pretty sure about that.
Right.
Yeah, that's the one area I would anticipate that we could absolutely use it, that we have to bulk up. And since those funds have, I believe we have to use them by the end of 2023, we could get 2 years in a budget of using some of those funds to bring on the additional teams that we need now, knowing that we will probably have to phase out as we go forward and we get rebalanced. So
Mr. Chairman, just one thing to piggyback on what Ms. Smith just said. And here's another thing, this is the way my mind thinks. Imagine every school district in the state of Rhode Island, and probably every school district in America, is going to have to address mental health issues with their students. So I'm thinking, and we've already started to have a preliminary conversation about this, is this country going to have the capacity to provide the mental health support that's going to be needed to address a situation of this magnitude? So I think that's another thing that is going to have to be addressed. Now, it may not be, we're going to have to really be resourceful in how we, get that support into schools. And every district in America is going to be struggling with the same thing. It's going to be a lot of competition for social workers and psychologists and mental health experts. I don't think there's any question about that. So
Right.
thank you, Mr. Chairman.
Mr. Fiorello?
Mr. Mitchell and maybe Mr. Demona can answer this, and I'm sure Dr. Santa also will chime in. Has there been any discussion about extending or expanding summer school to try to make up for some of the learning loss? Also, I just want to voice a concern that I have that with all the money that we will be getting from the ESSA funds from the federal government, my concern is that the state and even the town may try to supplant regular funding with that money for us, regardless of for.
So I can, Mr. Chairman, I can respond to Mr. Fiorello's question. I will send you, and I only had a chance to look at it for 5 minutes this afternoon, but I will send you the email from Anna Riley, Deputy Commissioner of Education, that will give you some sense of how the ESSER money can be spent. I shouldn't say give, it's pretty specific, but one of the areas of focus it is on summer, opportunities for students to at least start to try and catch up for the learning loss that they've experienced. So some of the money has to be designated to programming over the summer to address the issue.
Dr. Santa?
So several months ago, it's probably been 6 months, Annenberg Institute out of Brown University started doing some training. The Department of Ed recommended it. And the people that did the training are also part of the LEAP project, which you'll read in the ESSER 2 information that Mr. Mitchell will send out to you. And in that was talking about how do we provide high impact. They called it tutoring. I call it intervention. I'm not a fan of the word tutoring. And when I heard that there might be money attached to this project, I jumped on it like a bird on a bug and worked with to create a plan with how we could do additional services over the summer, very similar to how we deploy extended school year for special needs, but working with the regular ed population. I'm working with Lindy Fioli and Shannon Bissett on what students can we identify using our data. We're very data driven, as you know, so we've looked at our data. We're actually meeting tomorrow to look at it a little bit further so that we can put in what our proposal is. We already have an outline of a plan, and we have an appointment to work with the Annenberg Institute next week. Since they're so aligned with LEAP and ESSER, I think that the plan we submit would be accepted. My biggest concern, though, is we could put kids and provide services, but I'm not sure if I have enough staff to do our special ed folks, not along an additional 200 kids or whatever we design for providing additional intervention. And frankly, the number is higher than that based on our data. I can give you more information as we go forward, but I am very concerned. Our teachers need to take time off. They're not wanting to come back and work the month of July, essentially, and into August. There's very little time before the end of the year. So I am very concerned about having enough staff. We've already put our job application out for ESY, which we do couple months ago, which we do around February vacation every year, and we do have applicants, so that's not I might make do, but we've also put it back out saying regular ed can also apply, hoping that we'll be able to do this project.
We'll go to Mr. Fiorello, and then if possible, we'll go to Mr. Demona. I know he has a presentation for us as well. So Mr. Fiorello.
I just wanted to address the one thing I don't think I've heard anything about is I'm assuming that there has been a sharp increase in the number of students at the high school that are in danger of not graduating this year due to grades because of all the problems that kids have had. Do we know what those numbers are, and do we have a plan to address that? And will that also require some extended school year?
Mr. Mitchell.
So I mean, I cannot answer that question specifically. I know that there is concern about the number of students who have one or more failures. As you can imagine, the percentage of students with failures is higher than it has been in the past. We'll get that data for you. I'll make a note of it. We'll get that data.
Mr. Demana, I know you had a presentation you wanted to talk about for the district. Would you like to go ahead?
Sure, it's completely up to the committee. It's only really a slide, and it summarizes a summary of, generally speaking, how we want to spend the ESSER 2 money. And Rachel and I, along with my team, worked on it, and we can move through it rather quickly.
Okay.
And Mike has the slide, so if take a second from the queue it up.
Okay.
So, Mike, if you go to the next slide, Rachel, myself, and my team, we spent quite a bit of time reading some complex language on how the monies can be spent. You heard Mr. Mitchell allude to some of the guidance, but there is guidance for Biden money that's coming out that's highly restrictive, and there are certain percentages of funds that need to be used for specific things. The same applies to ESSER, but it's more broad language. They use language like learning loss, and that's a large umbrella. So we've heard a lot of talk about mental health. It is one of the 3 buckets that we are looking to address. And the 3 buckets are Tier 1, Tier 2 support, which is your core instruction, and your Tier 2, which is like the essentials courses and just general ed support that we have to provide kids after core instruction. Your intervention, which is your Tier 3 interventionists that we want to supply our schools and our students with. And then mental health. Mental health, and Rachel and her team spent a great deal of time talking about this, and then talking to me about how we would use those funds. It's about $2.2 million, which gets spent very, very quickly. It goes very quickly when you're talking about positions. So some of the things that we talked about, this is preliminary. Over and above, again, none of these are in Bob's budget, obviously. 6 essentials positions at the middle school for Tier 2. It would complete the Tier 2 essentials model that we started a few years back. It would provide 1 math and 1 ELA Tier 2 specialists at each grade level at each school. So grades 6, 7, and 8 would have 1 essentials teacher in both core content areas supporting those kids. And that's a manageable caseload. 1 essentials teacher cannot serve 6th, 7th, and 8th grade students, on top of knowing intimately the curriculum across 3 grade levels of difficult content to teach. So that is paramount. You see the next position is a multi-language learner position at McCourt. It's highlighted in yellow because that was one of the original requests at a bare minimum that we wanted to try and get into Bob's budget. That should exist anyhow, regardless of funds. And that would give Jay and McCourt 1 MLL teacher supporting each grade level. Right now, he does not have that supporting those students. They have to work across grade levels. And then you also see an MLL specialist at BF Norton. This position is some new thinking that Lindy and I put together. And because of the population, the high MLL population at BF Norton, and we're anticipating learning loss, many of Sandy's students who were distance learning were actually multi-language learner students. So we have a big concern about that. And one of the things we wanted to do is provide a specialist that pulls during intervention, not during core, but pulls ELL students and provides them with intervention every single day. We hope that to have a person that is a multi-language speaker in and of themselves to support those tertiary kids that really need that support. And what that would also do is it would free up spots in regular intervention for the general ed students who need the support. So it would really, really help us out. So basically the L students would have their own personal specialist to work with them each period at every grade level. In the middle column, and by the way, every position on here is a direct service position, which means all of these positions would be in front of kids. Every person would be servicing kids. The middle section, intervention section, is all based on data as well. And what this would do is it would make up for the additional numbers that we see in data, the inflated data that we see with regards to the impact of COVID with our internal data. So Garvin, what we would be proposing is an additional ELA, an additional math interventionist there, which would give Michelle 3 ELA interventionists and 2 math. Right now, she has a 2-1 ratio. Her data is on par with, BF Norton in terms of resources. BF runs with 3 ELA and 2 math right now. And we think that they need to be equal. Ashton right now has 1.5 ELA interventionists. We would add an additional half, which would give Nydia 2 service providers to work with in ELA and 1 math, so a 2-to-1 ratio. That would service the data that we're seeing right now. At community, just on sheer volume, they could use another ELA interventionist to service students. That would also give community a 2-to-1 ratio, ELA to math. Same story for Cumberland Hill as Ashton, 2-to-1 ratio. They have 1.5 right now, ELA, 1 math. You see the the positions there, 0.5 ELA, 0.5 math at McCourt, and then 0.5 ELA, 0.5 math at NCMS, which equates to 2 positions among both schools. Right now, they only have half-time service providers in each school. Each school should be equipped with their own ELA and their own math interventionist rather than sharing them across schools. And that would give each school their own, those positions should exist no matter what. You're always going to have students who need tier 3 support no matter what, regardless of the pandemic. You see the speech and language position. I'll let Rachel take the baton at this point. She'll talk about speech and language, and then she will move over into the mental health category.
Yep, so this would be the addition of one more speech and language pathologist in the district. I cannot tell you exactly how that would, where that particular position will go. It'd be a shifting throughout the district because our preschool is overloaded at this particular time, as well as there is a distinct caseload at North Cumberland Middle School due to the level of services that are required. Just to give you a little information, our preschool is currently getting 3 to 5 referrals a week. Typically, we may have 1. So we're being inundated, and almost always it's speech and language services. For mental health, again, keeping in mind the ESSER money has to be above and beyond. You cannot use it to supplant or to put back, you can't use it to pay for positions you currently have. These really do have to be new. So in looking at all that information and taking a look at the district, I put together what I think would be adequate. It's probably what, not to be rude, but to be what we should have. And then, and definitely to meet the needs of what we currently have. So, at the 4 smaller elementary schools, there's currently 0.5 guidance counselors. We would augment that, not with more guidance counselor, but we'd add an additional 0.5 social worker in each one of the 4 smaller elementary schools. At community elementary would maintain the 1.0 guidance, but we'd add a 0.5 school psychologist, making them have a full school psychologist at that building. And we'd add a 0.5 social worker. Keep in mind, community is about the same size as North Cumberland Middle School, and they run with significantly less mental health support. We would add back a guidance counselor at the middle school level so that both middle schools still have 2 guidance counselors, and I'd recommend the addition of another social worker, increasing each middle school to be 1 full-time social worker. At the high school, we would add a 0.5 school psychologist and a 0.5 social worker. If you add those up, it ends up being 3 social workers, 1 guidance at the middle school level, and 1, I don't know about the guidance admin position. I can't speak to that one as easily, and 1 school psychologist. Adding 0.5s, just adding a 0.5, if I just said, okay, we'll just do the psychologist at community and saying 0.5, those are much harder positions to fill, especially with this current environment. It's much easier for us to be able to fill a 1.0 position, a full-time position. I think by doing this, then we're giving every school their own social worker and their own guidance counselor, and then they already have that school psychologist to create a team. At the same point, I'm looking at universal screening, very similar to how we do academic universal screening, to look at the SEL skills of students. That would include screening as well as more diagnostic questions to put students with in tiers of support, just like we have for academics. So I'm looking at components of that right now and demoing it and working with our folks on whether or not we think that would be a good addition. So that's what I would recommend.
Thanks, Rach. May I add one point? those funds, these funds are only, would only take up 1 year's worth of supporting these positions. So I want to just make that clear. All of these would have to get wiped out. Now, if the Biden money comes in, and I think Alex had mentioned around $4 million worth of Biden money, and if we have enough monies after all of the certain percentages that we meet where we have to spend it in certain areas, if we have $2.2 million left over of that 4 million, then we could potentially get 2 years out of these positions and have to worry about, you know, what cuts, what's going to go in that third year. If we do our jobs correctly, hopefully that middle column would start to go back to normal, would you know, go back to the normal interventionist service providers that we have in the schools. Of all of these positions, some of those other jobs may have to make future budgets depending on what happens. And I'll speak for the teaching and learning end, not Rachel's end, but the 6 essentials positions and those MLL positions would be critical, and I would fight to keep them 3 years from now. Mike, can you go to the next slide? I think it's just.
Hold on one sec, Mr. Demana.
Yes.
Dr. Santa had a question.
No, I was just going to just emphasize that when we do social workers and school psychologists and guidance, that's for all students. That's not necessarily a special ed only type position. They really do work with all kids. And that there's also a pretty significant chance that they're going to be increasing IDA funds, the special ed funds, to get closer to better funding. So there might be an opportunity down the line where we might be able to offset some of this cost by using additional IDA funds. That's kind of what I'm hoping for, but we'll have to see.
Right. Okay, Mr. Demana.
Mike, thank you, Mr. Chair. Yeah, this is redundant. I just went over the narrative. Mike, can you go to the next slide, please? Yeah, so basically these funds, it doesn't address any materials or curricula or any evidence-based intervention materials. This is purely positions, and it ate up the money really, really quickly. But the Biden money does have certain criteria where those evidence-based intervention materials, curricula, not the type of curricula that we're talking about for the district over the next 3 years. There are things in there that we're going to have to spend for that money, but it's a separate pot. So that's it in a very quick, summarized manner. Thank you, Mr. Chair.
Thank you. Anyone from the school committee have any questions about this? Go ahead, Mrs. Smith.
Surprise. I just have a question because I believe that when I listened in on the achievement call for the subcommittee for the achievement back in early March, that there were 13 positions at that time proposed, and some of them were going to be absorbed in. So are you saying this 21 was not covered under that in the budget already for those 13 that you had discussed in the movements and shifts? And I apologize, I cannot find that presentation now online. So perhaps, Mr. Demana.
No worries. There were only 4 positions that I proposed to Bob that were new positions. All of the other moves would have been reallocation of existing resources. So, for example, where right now Nydia has 1.5 ELA interventionists and 1 math, we're proposing with that ESSER money to make her whole at 2 ELA and 1 math. What we would have done under conditions where we would not be receiving monies, we would be repurposing her half-time person, reducing her to 1 ELA, 1 math, just so that community could get some relief because of their volume. They only have 1, so they would have shared the 1.5 resource. So that's what I presented during achievement. There were some internal movement positions that would move around, but the only 4 positions that were presented to Bob were a high school curriculum coordinator, MLL position at McCourt, and the ELA and math interventionist that would make both McCourt and NCMS whole. I wanted to get that MLL BF Norton specialist position into the budget, but as a 5th position, but it was not presented to Bob at that time. That thinking came later on. So does that make sense? It was only 4 positions.
Right, and I agree. You had said 4 positions, but I did think that in the presentation that you had absorbed the remainder of positions and that you were requesting the 4 more. So I'm just wondering, that was at the beginning of March. Now we're at the end of March. So I completely agree. We have ESSER money coming in. We have to have the mental stability of students. It's critical. But what has changed to dramatically increase that number? And please don't take offense to that. I just have to ask that question. What's changed so much to increase it to that level?
So right now, I would say that we operate deficient of these resources, and we've been operating deficient of these resources that we should already have. McCourt and NCMS should have those essentials positions in place proactively, and we don't have the money to ever add them. If I push those positions into the budget, Alex would say, you're only forcing me to have conversations with Bob about cutting other things. So I can't push $2 million worth of positions into the budget without causing an effect on the other side. So the only real inflated numbers is column number 2, which addresses the inflated data internally that we have on the students who are struggling because of the gaps created by COVID. So that middle column is the real and you could argue maybe some of those positions, half a position here or there, like community, they could really use 2 ELA interventionists just based on volume normally. But the middle column is something that you would see inflate because of this and perhaps hopefully dissipate to a normal level if we do our jobs. The essentials jobs should stay. The MLL supports, you heard Alex talk about BVP beating us in one area. That's one area that they outperform us. It's also an area that the accountability system dings us on in terms of their performance. So our school report cards and our district report cards, the MLL community and those students, that subpopulation and their performance impacts us as a district and our standing. So we have to have those supports in place. I'm just never able to add them. Bob is never able to get those through because all it would do is create some type of cut somewhere else that we have no room to go.
So we are then looking at the reallocation of whatever those positions were. The 4 have already been added into the proposed budget, and this is the additional use of the ESSER money for the 21 net positions.
Bob did not add the 4 positions. I requested them. He did not add them. 3 of the 4 made it into ESSER as a proposal. The high school coordinator position does not qualify for ESSER funds. So that position is out there floating for discussion, I would imagine, on Thursday night.
In the reallocation of the remainder of the positions, you would still work with that because it's already been in the budget.
I wouldn't have to, I would retract some of the moving of resources if we're able to use those ESSER funds and get those positions in those schools. I wouldn't have to move any half people around to, rob Peter to pay Paul because the ESSER money would fill in those gaps for those schools.
Okay, thank you.
No problem.
Question for Mr. Pignano. If we were to bring back those 21 positions for the year, does that number that we saw, the ESSER, include pension, healthcare, the added cost that we have to deal with throughout the year?
I think it would. I think Tony worked with a number of $100,000 a position.
Yes, I did. 21 positions at 100,000, 2.1 million. There's some excess of 100,000 and change.
Okay, and
it'll be a few bucks either way.
So this would go to Mr. Mitchell then. Mr. Mitchell, obviously you only had a little time to look at this today and come up with a plan. Do you think on Thursday you will recommend that we put these positions into the budget for at least 1 year, if not more, going forward?
You mean the positions that we can use ESSER money to support?
Correct. Yeah.
Well, you know what, like I said, I've only had literally 5 minutes, not even to look at the email that I got. We'll give that some thought tomorrow, and if we can be a little more specific about how we can use that money, and then certainly we will share it with all of you on Thursday. That will be the goal. But so tomorrow is going to be, despite the fact that we have a crazy busy day as it is already, we'll fit some time in to have a conversation about, wait till you see the level of detail in the questions that have to be answered on how we're going to use the money. It's going to require a tremendous amount of time and effort to do all that work, but we'll do the best that we can, Mr. Chairman.
Right. Anyone else? I see Mr. Collins.
I have a question for Dr. Santa or anybody who might be able to answer. Going back to the mental health services, do we have the ability, the potential to contract out? Because when we're talking about pension and fringe benefits and all this other stuff, do we have the ability to forge a partnership with some sort of mental health services where they could provide the kind of blanket services for our students at a contracted rate? I'm just kind of brainstorming a little bit. Maybe go through private insurance. Do we have the ability? Can't go through private. I see the head shaking. What about doing something along the lines of having supervised, maybe groups or the group instruction, like therapy groups, and have it supervised by an LACSW and have a grad student?
So I can answer. That's a great way of asking. And we actually already do contract for a significant amount of clinical services from the Center for Psychology and Learning, which is Dr. Dana Oswicki and her crew. And that helps in order to keep our most needy students in district. Otherwise, those students would be placed out. So we contract for, I want to say, almost $250,000, Alex, plus about $250,000 worth of clinical services. I think in this case, I would not recommend that we go and contract out for services to provide in school. What we do in school is not necessarily therapy, as in what you would think of as a standard therapy, where you're going, to talk about your most internal issues. We do not want necessarily to have that during the school day, because you don't want to unzip a kid and then send them off to algebra, or unzip a kid and then send them to, ELA. It's just not the right thing to do during a school day. Our staff, our mental health staff, are really here to help students problem solve and to help them to develop coping skills and to be able to process throughout their day and be able to kind of handle school. But they're not there to necessarily handle the more intricate details. That would really have to do with a different project that I don't have time to work on right now, but have been part of in the background, is where you develop a collaboration with an out-of-district facility like Community Care Alliance or something on those lines, and we create that relationship. We already have a relationship with them, and when we've had to do grief therapy, they've come in and helped us to handle an unfortunate death of a student or a teacher. If you're asking to contract for these services, if you're talking about the social worker and contracting for that, what you're going to create is not create the same level of comprehensive services. And we also find that contract services often can change pretty quickly. We do contract for OT services. We do contract for a part of one of our speech services in order to save funds, but that would not be my recommendation for social work or school psychology. I think they need to be part. I'm not saying our contract people are not part of the schools. They are, but they're not supervised by us. They're supervised by outside people. That's just the way consulting works, right? Or when you hire from an outside contractor. The benefit is if you don't like someone, you say, I don't like your contracted service anymore. But overall, I think for these services, they really need to be embedded within our school. They need to be part of the school culture. They need to be working on our tiered supports. They need to be part, just like our interventionists in academics are part. That would be my recommendation.
Great, thank you.
That makes sense. It's getting late. I'm tired.
No,
I want to make sure it makes sense.
My only concern is that for some of these kids, you were mentioning more of the comprehensive, cognitive therapy and all this other stuff. For a lot of these kids, just like sometimes school's the only place where they can get a decent meal. Oftentimes, my concern, and I've seen this with students before, school's the only place where they can receive decent mental health services. So hopefully, if we can add guidance counselors, perhaps they can work with the caregivers to provide those services outside in the community. I understand you don't want to create a mental health crisis in the middle of the school day, but
No, it's actually really a big part of a social worker's job is it's everyone's job, but definitely a social worker's job to make those connections into the community and with families. That's predominantly their work, is helping kids to make those connections, as well as providing social skill groups and other things that our students need. So again, I think I understand the conversation. I have a mental health background, so I definitely understand it, but I also think that we need to be careful about when that happens, because then we start having issues with supplanted services and not supplemented services. There's a lot of factors that go into that you may not consider. I do think creating alliances with places like our Community Care Alliance for after school services and creating a wraparound program is really in our best interest. That is a project that, I'm part of the Children's Collaborative Trauma, I'm losing my thought, sorry, the Childhood Trauma Learning Collaborative through Yale. So is Lisa Parker, one of our social workers. And that is one of the projects that they help to emphasize and support. But it's a whole nother big chunk of work that I didn't feel like I could take on right now. I wanted to work on these components first and then look at that for maybe next school year, developing that relationship. I've been part of those conversations as how does it work? Because it does work like this in a lot of rural areas and a lot of other areas in other states, but it's just not the model we use here for the most part. So I think that's our next project, but not now. If I make it through the summer, I'll be happy.
Mrs. Rogalski, you have a question?
I want to say how happy I am with that ESSER money distribution. That really, I'm very pleased. I remember going back to that achievement meeting that Mr. Domano was saying, this is the bare minimum we need to get by. And this allows us to have that and so much more that we need, because our students deserve much more than the bare minimum to survive. And so I really think that those positions are well thought out and well allocated, especially, and Dr. Santa mentioned this in an email to me today about, you're going to be looking at reclassifying students into different tiers. So we might see those numbers increase and we're going to have more need next year. So just having those specialists, I think that I'm very pleased to see how that breakdown was. And I understand there are so many things that the money could be spent on, but I personally think that this is a really good decision for our students.
Okay, anyone else have a question at all? I mean, I know in this budget, just think a couple of years ago, if the state aid hadn't been cut 800,000 2 years in a row, would have most of the money here to keep these positions. But question, I don't know who could answer it. How many guidance counselors did we lay off last year? And would they all be called back?
I think 3 total. I could be mistaken,
Katie,
but I think it was
Katie
3.
will know. Katie,
3 at the elementary, 1 at the middle, and 1 at the high.
So would those,
So there were 4 people on layoff though. And I don't think they would all be back.
okay. Dr. Santa?
I was going to say what I proposed was that one of those positions come back and that the pieces that people want to come back be replaced with social workers, because the reality is before COVID and all through COVID, we have 3 social workers and 6 school psychologists for nearly 4,500, almost 4,600 students. That's so inadequate that it's almost embarrassing. We added another social worker a couple of years ago. Before that, there was only 2 social workers and I think 5.5 school psychologists. So, the plan I put in place to put we're proposing and not put in place, propose is that with that part-time social worker and having guidance creating a team. So then you can have your tier 1, tier 2 support. It's very similar to what the guidance counselors were presenting at a couple of school committee meetings ago, the slide presentation I made. It's really to help support that work. One thing that we can't use ESSER money for, but that I would highly recommend, I'll just put it in your ear, is to really think about maybe doing a seasonal meeting, testing season, and having a clerk work from January to the end of the school year for 3rd grade through 8th grade to do all the RICAS entering of data into the PAN system. Because our guidance counselors right now are spending just about all their time working on RICAS testing and not doing guidance counselor work. They're not working really with kids as much, or hardly any, because they're spending so much time doing what I would consider to be clerical work. So something else to consider for next year. We don't have money in the budget, but it's something to consider that would free up people to do what they're really intended to do
Right,
for a low cost. That'd be
right,
that'd be a, big bang for your buck.
yeah. Anyone else have any questions in regards to this? Okay, does this conclude the presentation, Mr. Pignano,
Yes, it does, Mr. Chairman, for tonight.
for tonight? And Mr. Mitchell, on Thursday night, we'll get a maybe a proposal, and a recommendation to have positions in using this ESSER money.
We'll make every attempt to do that, Mr. Chairman.
Okay, well, just in a closing remark, I think we're showing the town councils and the mayor that we're taking the, what's happened with COVID with our students very seriously moving forward, and somehow try to, find more money every year to keep these positions here. So, this is only a one-shot deal unless the president of the United States gives us more money. And it sounds like it could be that, we could get a couple of years out of this, what's going to happen. So, all right, thank you, Mr. Mitchell. Mr. Chandler, I can't see if anyone from the public is on the call here that would like to make a comment or anything. Could you, I can't tell how many people are on our call.
Sure, we have a few people that are out there. If anybody would like to make a comment, you can raise your hand. I don't see anybody on the phone, so they won't need a *9, but they can raise their hand if they'd like to speak.
Okay. All right, well, I don't see anyone here that are participating in this. So we'll move forward from public comment. I would just like to say that we're going to have another meeting on, for those that are listening, we're going to have another meeting on Thursday to discuss this further and possibly the fiscal take a vote to send it to the full school committee, or we could end up adopting a proposal this coming Thursday that we would send off to the town, and hope again, I know those that listen, we are looking for the 4% from the town to make this work. And I know Mr. Pignano has talked to the mayor numerous times about ways to reach the number that we need without making it difficult in the town. So, but this year coming up, certainly we need to make a big change, so we can get those students back to where we need to see them at. So I don't see anyone, again, raising their hand, so I will make a motion. I need a motion to adjourn the meeting at 7:36 p.m.
Motion to adjourn.
Motion by Mrs. Feather,
Second,
second by
Mr. Gauski.
Gowski. All in favor?
Aye.
Aye.
Opposed? I have it. I just want to do one more thing for fiscal, because this is a dual meeting. Need a motion from the members of the fiscal subcommittee to adjourn.
Motion to adjourn.
Mr.
Second.
Collins makes a motion. Mr. Smith makes the second. All in favor?
Aye.
Ayes have it, 3-0. All right, thank you everyone for participating tonight. And as Mrs. Friedman said, we've got to be aggressive here with the town and make it known. So thank you, everyone. Great presentation by Mr. Damana, Dr. Santa, the superintendent, Mr. Pignano. Thank you, everyone, and I'll see you Thursday night.
Thanks, everybody. Thank you. Good night, everybody.